So I'm Eric Berthera from Pandemic and Epidemic Disease Department at WHO Geneva. And leptospirosis is one of the diseases we are in charge of. So now we are going to move down from rocket science to the approximation of the public health intervention, specifically in emergency situation, because I would start by coming back on an event which occurred in 2009, which was an outbreak of lepto, which occurred in the Philippines. Philippines, it's a highly endemic country for lepto, with around 700 cases a year, and a seasonal activity with a peak during the rainy season. And in 2009, there were two typhoons occurred, and in the following weeks, thousands of people were displaced in the country, and we observed several outbreaks of lepto, including the capital, Manila, and in the two following weeks of the typhoon Ondoy, which occurred 26th of September, we observed more than 500 suspected cases of death downtown in Manila. So this outbreak was very spectacular. So maybe coming back to the burden topic that Albert talked about yesterday, we must say first that the parts taken by this kind of outbreaks inside the global burden, that's peanuts compared to the sporadic case and the endemic activity of the disease. But these kind of outbreaks are very spectacular. There is international concern. They mobilize a lot of resources, and especially when they occur at a time of natural catastrophe like this one. And this outbreak is also important because it triggers the decision at WHO to revise the strategy for control and prevention of this infectious disease. Because indeed, when this outbreak occurs, we receive a lot of questions from the Ministry of Health. And there was a lot of questions regarding the control and the management of this outbreak. First, they had a lot of problems regarding the case management, because there is something which is something which has already been explained, that the problem of the diagnostic of these cases of lepto. And this is the problem of the lack of specificity of the clinical presentation, and also the problem of the lab confirmation, which is a real issue. So in this kind of situation, when we are in a crisis with floods, you have to implement a triage operation, which are very complex in this emergency situation. And you also have to deal with a lot of severe cases, which is quite specific to this infectious disease, to this kind of epidemics. Because in addition to all the mild form of the lepto, which finally doesn't reach the health facilities, you have all these severe cases, for instance, the pulmonary hemorrhage, which are very complex to manage on a logistical point of view in this kind of situation. So we had a lot of questions raised by the Ministry of Health regarding human immunization, regarding the use of chemoprophylaxis, and despite the advice, the technical advice of WHO, which was against a mass chemoprophylaxis, almost 2 million doses of doxycycline were distributed to the global population in the capital. And we had the technical issue regarding this mass distribution, and for instance, was it rational to give antibiotics to the population, considering that the floods were expected to stay a long period of time, for instance. We had also a question about the utility of doing a decontamination of the water or to implement rodent control. So we had a lot of questions. It was very difficult for us to manage this and to give technical expertise. because when we look back to the strategy, in fact, we understood that we were not ready to manage this kind of outbreak, and there was something to totally revise in terms of control. I borrowed this this curve from Claudia to underline something which is very important. So I talked about this outbreak, these big outbreaks, which are very spectacular. But between this outbreak in the endemic countries, you have a baseline activity, which could really differ according to the different settings. In some countries, you have only sporadic cases. In other countries, you have a seasonal activity. So it raises a technical question, which are not only a problem of understanding, but it's also a operational problem in terms of preparedness and response. How can we make the difference between a seasonal increase and an outbreak? This is important because for this kind of big outbreaks, the one we saw in Mania, you can think that you are going to implement specific control strategy, which is not the case when you have a simple seasonal increase. So this kind of big response when you have a big outbreak, it mobilizes a lot of funds and resources and so on. So when you have in front of an increase of the number of cases, it's important to make the difference between the normal seasonal increase and a big outbreak. That's an issue we had with other epidemic diseases, and Peter, you remember, we have exactly the same kind of problem with epidemic meningitis in Africa. If you start to launch a big outbreak response, vaccination campaign, and blah, blah, every time that there is an increase, you are going to spend all your resource maybe for things which are just natural activity and not a big outbreak. So this is first question, what is an outbreak? And that's something we still have to define on an operational perspective. Another problem which is linked to that is the case definition. When I showed the first slide, you saw that I've talked about more than 500 suspected cases. And in fact, during this outbreak, very, very few of these cases were lab confirmed. So this is a problem. We can trust in the clinical capacity of the physicians there because they are used to see molecular cases, but that's a little bit difficult to just manage suspected cases without a real case definition. That's one of the big problems with lepto. So let's come back to the different possibilities and potential intervention. And so I come back to this very famous cycle, the Albert Koh cycle. And let's first... So let's first have a look to the reservoir. What can do in terms of reservoir? And again, let's consider different epidemiological pattern. We are in an endemic situation or an outbreak situation. When I say outbreak here, I'm referring to these big outbreaks, mania kind. So in terms of water, hygiene and sanitation, that's the problem of sewage, and that's something for to try to prevent the incidence of leptospirosis. When you are in outbreak situation, you can discuss decontamination, very difficult to implement. Provision of safe water, probably yes, that's something which can be done. In terms of rats, I'm going to be short here because we expect another presentation. There is certainly a room for control when you are in an endemic situation, but when the outbreak is already ongoing, I think that's too late for the rat control, but you can do rat proofing. Regarding the domestic animals, in endemic situation, we can discuss the vaccination and the impact of the vaccination of these domestic animals and mainly cattle on humans. So animal vaccination is mainly used in developed countries to limit the effect of the infection on the production. That's something we have already discussed. But the problem is that with this vaccination, it doesn't completely prevent the excretion of leptospira in the environment. We just think that it prevents the infection by reducing the number of lepto. In few studies, for instance, in New Zealand, we observed that vaccination of cattle, and there it was deers, had a real impact on human infection. But here we are mainly talking about occupational disease. So among the farmers, the fact of vaccinating the cattle had a real impact on human infection. But we can only remark that at the same time there was an intense campaign of sensitization. So making the difference between the impact of the animal vaccination and the sensitization campaign could be really difficult. But that's a way to explore and to clarify that, sure. The problem is that before implementing vaccination among your animals, you need to have some information, and specifically to have some information about the circulating serobars in this place. When in outbreak situation, of course, there is no room for any action on domestic animals. That's too late. Wild animals, so that's something which has never been evoked so far. In endemic situation, is there anything to do on wild animals? I'm not sure that this is feasible. And in outbreak situation, we can forget too. If we now look at the transmission, there is clearly a room for health education, specifically in endemic situation. In outbreak situation, that's a little bit difficult because there are a lot of message to distribute to the population for other infectious risk, for instance, cholera and so on. The physical barriers, I was discussing with Vincent this morning, and he explained me that, for instance, in Thailand, there is very successful measures which were taken with people working in rice field. They were convinced to use gum boots and gloves, and it seems that it has a real impact on the transmission to this kind of population. So the use of physical barrier, wearing boots, covering clothes, etc., that's something which could be used in certain circumstances in endemic situation. In outbreak, that's the same, even if it's more difficult to implement. Well, it's not the most important, but coming back to the human host, there is a problem of the case management, and that's something I already say. In terms of endemic situations, there's a big problem with the capacity building, and that's the issue of the management of all these fevers of unknown origin, which occur in most of the tropical countries. That's a big, big issue. Every time you discuss with people working on dengue, they come back with this issue. You discuss with people working on rickettsiosis, they'll tell you the same, lepto. So there is a common platform here, a common concern for all the people working on these different infectious diseases. How can we manage these fevers in tropical countries in circumstances where we don't have a rapid test? What kind of syndromic approach we can have? And here there is a lot of things to do and to see what's the place of lepto in this management, in this capacity building. In outbreak situation, that's something we have already discussed. That's the problem of the early warning, the problem of the triage, the problem of the severe case. Regarding the chemoprophylaxis, well, in endemic situation, it's difficult to discuss about chemoprophylaxis out of very specific high-risk population in some groups. That's something which is used, for instance, for militaries during operation or for some travelers. But of course, that's a chemoprophylaxis which is limited in duration, which must be limited to the duration of the exposure. So for the general population, we don't think that there is a room for chemoprophylaxis. During outbreaks, that's the same. As I said, we do not consider so far that there is a room for mass chemoprophylaxis in this circumstance. That's something which is very difficult to manage, And mainly when you distribute doxycycline, which is an antibiotic with a very broad spectrum, and you don't really know what you're doing when you're distributing these antibiotics like that. So I think that's something to forget. However, we can consider, for instance, for the staff in charge of rescue operation, that they could benefit from a chemoprophylaxis during the duration of the operation. But there's still something to clarify. Regarding the vaccination, in endemic situation, in fact, if we are talking about human vaccination, you must first know that, as far as I know, there are only 3 producers of human vaccine for worldwide. One is in Cuba, that's Finlay, as I know, and they have produced their vaccine for their own purpose. So that's a vaccine targeted on the circulating serovar in Cuba. So a priori, you can't export this vaccine elsewhere without knowing what is the circulating serovar. So for instance, they propose in Mania to the Ministry of Health to sell them their vaccine, but without knowing what was the circulating serovar in Mania. It was something we couldn't recommend. Yes?
I'm just wondering if the vaccine is protection against infection or protection against
That's against clinical symptoms. And there is a vaccine which is produced in France, which was developed in the 60s with a very specific target, which was for occupational disease, for people working in sewage. So, for instance, in Paris, the staff working in sewage are regularly vaccinated with this vaccine. But that's an old-style vaccine. That's a kind of soup of bacteria. But in terms of efficacy, there is no real study which has been done. It's still implemented. It seems that there is some efficiency, but it would be interesting to really look at the efficiency of this vaccine. As far as I know, there is no other European countries having this kind of targeted vaccination. It's a kind of specificity of France. It's used also in the French army for some specific staff. And I think that there is a vaccine produced in China, but like many Chinese products, we don't really know what kind of product is it. It's not exported, and we don't know really what kind of use is done with this vaccine. So this is to say that there is a very limited availability of this vaccine, and mainly the problem is that these vaccines are serovar specific. So as long as you don't know what are the serovar circulating in your area, you can't use one of these vaccines. The vaccine produced in France, for instance, I think it's targeted on icterohemorrhagia. So this is a big problem. We have all this question about immunity and herd immunity, for which we don't have a question either. And so the problem is on our side is that certainly there is a room for a vaccine or different vaccine. The problem is that in terms of research of development, if we want to be able to mobilize political interest, to mobilize big funding around the lepto control, including the vaccine, we have still a lot of questions. We don't know which kind of vaccine we need and for doing what could be the vaccination strategy. We don't have any idea or clear idea of what should be the target serovar. Of course, if we could have a vaccine covering all the different serovar, it would be the Graal, but we are far from this. What could be the target population? Something to be discussed. Are we talking about a vaccination to prevent the disease, or maybe a vaccine to react to outbreaks? That's another question. And for the time being, as the GLEAN, the Global Leptospirosis Environmental Action Network, to respond to the emergency, to be able to respond for the next outbreak, for instance, we decide to list preliminary recommendation for outbreak control. So that's something we try to revise every year. So even if we don't have all the questions, to be sure of our recommendation, there was here a public health emergency. It was important for us to be in a position to make recommendation to the countries. We can't reply to a Minister of Health, chemoprophylaxis, but we are still waiting for the result of the study, and we can't say, no, it doesn't work like that. You need to make a recommendation based on the partial results we have. So these are the preliminary recommendations which are on for the time being. So it's still very important to collect specimen and to lab confirm this specimen, for not being in the situation we observed in 2009 mania. We recommend empiric treatment of probable case because it's difficult to confirm all these cases. We recommend the use of individual prevention to the population and to use clean water. In terms of chemoprophylaxis, we absolutely not recommend mass chemoprophylaxis, but as I said, we can target high-risk group. Decontamination of water, it doesn't seem really applicable in this situation, so it's not recommended. Vaccination, no. This is not the situation. Rodent control, that's too late for implementing rodent control when you have the outbreak. So that's something to be done before to prevent, but once you are in the middle of the outbreak, that's better to use the resource for doing something else. And of course, communication, health education, social mobilization, that's still very important. That's not only a gadget.